Thank you so much for joining us today. Welcome to our Breaking Through community and our Breaking Through conversation. Before we begin, I want to ask you a simple question. When was the last time you truly focused on your own health? Not your family's, not your jobs, but yours. See, here's the truth. Many people, especially immigrants, spend years taking care of everyone else, kids, work, family, community, places of faith, while our own health quietly slips to the bottom of the list. Well, I am Marian, host of our Breaking Through conversation. Thank you. Today, we are talking about something every immigrant and everyone needs to hear: taking charge of your total well-being. Our health is more than checkups. It is our greatest asset as we build the life and opportunities we came here for. So I'm honored to be joined by three powerhouse women who will help us chart a practical, doable wellness path for 2026. So help me welcome them. Yeah. Before we dive in, I will invite each panelist to introduce themselves and to share one hobby they enjoy. So I'm going to start with you, Belinda.
Good morning, everyone, and again, welcome. I am grateful and excited to be here this morning to share with us all. I am a clinical pharmacist, and I have been a pharmacist for the past 25 years. I currently work in a area hospital as an oncology pharmacist. So I mostly work with patients going through chemotherapy. And I am been married almost 30 years, and I have two amazing boys, Caleb and Caden. And again, I'm glad to be here.
Thank you, Belinda. Now I'll go to you, Kendra. So we have a pharmacist, as you all heard. Thank you, Belinda. Kendra.
Good morning, everyone. My name is Kendra Osewuzu. I'm a family nurse practitioner, doctorally prepared, currently practicing at an urgent care. I'm married. I have one child with currently one on the way. So hopefully I'll be a mom of two soon. And then one hobby that I love to enjoy is traveling. I like to travel and I like to just experience new things, especially with my little family. So those are my hobbies. And again, just like Miss Belinda, I'm also very excited to be here.
Thank you. Travel. Belinda, what was your hobby? I don't think.
I love to cook.
Oh,
I
cook.
really like to cook. Yes.
Okay. Travel, cook. Now to you, Sword. So we have a pharmacist, we have family nurse practitioner, and then we have Sword, who will introduce herself as a psych nurse. Go ahead, Sword.
Hello, I am Sword. I am currently a psych nurse practitioner. I also work in long-term care, so I do that as my base job, but I do work as a psych nurse practitioner. My hobby first, I would say I love cooking. I think
Oh,
cooking, and not only cooking, I love cooking for people. I love when people
Yes.
eat what I cook. So that is one big hobby for me. And I do have a daughter who is 21 years old. I've been working in the nursing field for over between 17 and 18 years, I think. And as a nurse practitioner for the past maybe 2.5 years or so. And I just love what I do. And currently, I have my own practice, which is in Maryland, Owens Mill. And I just opening that in June of this year. So that's just what I do.
thank you. I don't want to go into Sword cooks very well. Melinda also cooks very well. Let's not go there. Okay, so if you are joining us, tell us from where you are joining us. Welcome. And the usual, we will take questions. If you have any questions, this is a very important topic. And just hearing their introducing themselves, we have over 50 years, maybe I think something like 60 years of experience here. Let's take advantage of the experience that they bring. So we have a few questions. I will start with you, Belle. What does total well-being mean to you, and why is it essential for immigrants especially?
The word total is because what first comes to mind as in something that's complete, something that's grounded. So when we say total well-being, it's the well-being of the entire individual. So it's not just your physical well-being, but it's your emotional well-being, your mental health, your spiritual health. And I think when I look at an immigrant lens, I think maybe we tend to think more of the physical health and not the rest. And I think more so recently that we are now really looking at mental health as being important. I think when we talk about mental issues from an immigrant standpoint, as a Ghanaian, it's almost a stigma, that there isn't really such a thing. I was just recently in Ghana just a few weeks ago, and I actually saw billboards that addressed mental health, that there were places that people could go. And I was like, wow, we are really getting into this mental health and actually taking it seriously. And I have to say that I still know people now who would either say it's demonic or, that it's an excuse to do something. And I really still can't wrap my head around that people are still thinking that. So for total well-being, it's just really being well altogether, being whole. And in order for you to be whole, you not only do you have to be physically well, you have to be emotionally well. You have to be emotionally sound. You have to be mentally sound. You have to be emotionally sound. You have to be a place where you're not ticking up every single time a situation happens, and being able to take care of yourself through all those different avenues.
Wow. Oh, and it's, I see Swat smiling because she's mental health nurse, so yeah. Swat, anything to, I see you smile. I don't know why you're
No,
smiling.
I'm smiling because I love it. I love when we talk about mental health, and especially in the immigrant community. It is something that is not being told. I'm from Sierra Leone, so I understand that. Sometimes it looks like a taboo, but it's not. And one reason why I went into mental health is because of that. In my community, I need to be able to figure out exactly with the growing kids. I've seen it firsthand for me with my own kid, with people around her and people around me that have mental health issues, but we never go back to see we never seek professional help. So for me, that's the reason why I'm smiling, because I understand where Ms. Belinda is coming from. For total health for me is, total well-being for me is just being comfortable, just being peaceful, your mind, generally just a well-being for me as an immigrant is imperative. That being healthy and comfortable and peaceful, what it means having a checkbox to say, I done everything for me, as you said, physically, mentally, emotionally, meeting all those criteria every day is what total wellness means for me.
Oh, goodness. You are so bright. Kendra, anything to add? You're on mute.
Can you hear me now?
Yes.
Yes. And I love the responses. I was also, smiling as Ms. Belinda and Ms. Ward were speaking. I'll definitely piggyback off of that. And just in addition to physical and mental and emotional well-being, right? Because that also deals with total social well-being as well, especially when it pertains to immigrants. I'm a product of immigrant parents. So I just know that the social well-being, as far as them belonging to a community, is also a part of total well-being, and also economic well-being. There's a lot of uncertainties from what I witnessed, and my mom especially, when jobs and finances weren't as certain. So in addition to physical, mental, and social well-being, economic well-being is a part of there. And then lastly, I would say cultural and spiritual well-being. Just as you're navigating this new world, being able to stay true and honoring our culture. I'm from Ghana, so honoring our culture, beliefs, and certain identities of being Ghanaians without shame or fear, if that makes sense. So I
Mhm.
believe that also encompasses the total well-being, physical, emotional, mental, social,
So
economic,
cultural.
and spiritual. Yes, ma'am.
Yeah.
Whoa, 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 whoa. I did, oh my goodness. Complete, rounded, whole. Physical, emotional, mental, social, economic, spiritual, and cultural. And that comfortable, peaceful, all sort of related. Thank you, thank you, thank you. Now let's go to the next question. When we say take charge of your health, what does it look like in everyday life? Truth be told, I'm an immigrant. I have family here I'm taking care of. I have family back at home. I mean, get a request. I need 500 Ghana cedis. I need pounds. How can we take charge without really running ourselves down? Because I think from what Kendra said, the economic really ties into that total well-being. So let's start with you, and then we'll go with Belinda and end with Kendra. Yeah.
All right. One example for me is putting yourself first, making yourself a priority. I think for immigrants, most times we do not make ourselves priority. We make ourselves either, it's not even second. You put your family first, you put the people that you left back home first because we think we have the responsibility to make sure they're okay, but not taking care of ourselves. So taking total charge of our own life just means being able to put myself first. Some example would be, am I the best? Am I okay? Am I the best version of myself? Did I take care of myself enough? In everyday life, it just means I have done all I could to make my mind okay, to get my mind into a better place. My wellness is accounted for. Have I done the ultimate best for myself in taking care of myself? That's an example I'll give. If sometimes you have vitamins that you take every day, did you take your vitamins in the morning? If you have blood pressure issue, have you taken your blood pressure? Because sometimes we're in a hurry to go to work. You either forget. I've seen a couple of patients in my practice that will come in, oh, I forgot to take my medication. I forgot to take my blood pressure, and then end up in the emergency room. So just taking charge of yourself. Have you done that? Do a checklist for yourself. Ask yourself those questions in the morning and say, have I done this? Have I done that? I know the people back home, the people need money today. They need to get this done. But what about me? Have I done something for me? So that's what I would say, taking charge of your own life mean.
Yeah. I like that, having that checklist. Something as simple as having a checklist. Have I taken my medication? Take care of yourself. Take care of myself. Speaking to myself. Yeah. Whilst Belinda, you are getting ready. Greetings from Canada. Powerhouse,
Hey.
Ghana. Said
Hello.
congratulations, Kendra. Joining from Mountain Time, Utah Valley. Oh my goodness.
Wow. Nice.
So thank you for joining us. Thank you. Belinda, please.
Taking charge of your health, you have to be the one to take responsibility. Your husband's not going to take the responsibility. The people that you're sending money to, or the people that are pulling you are not going to take the responsibility. It begins with you. Your doctor is not going to call you and say it's time to make your physical appointment. You have to take charge. You have to be, like Swart said, you have to be the one to take that medication. No one's going to remind you to take that medication. Now, when you are about to take off on a flight and the flight attendants are telling you what you need to do in case the cabin pressure goes down, they tell you, if you're with someone, you're with a child, you're with somebody elderly, what do they tell you? You put on your mask first so that you'll be able to help the next person. So until you are well, that you can be able to go to work every day to make that change that you can send to whoever or help whoever, you got to take charge and got to take care of you first. We're all mothers here, at least, on the panels. I know I'm always go, and making sure this person is fine, and that's even at 23 and 19, as soon as they call, like, what do you need? What's wrong? Mom, can I just call to just check on you? So we're always predisposed, especially the women, to take care of others first. But we need to also remember that in order for us to be able to take care of the other needs of other people, we have to be 120%. We have to be well. So we have to be able to take charge, practically making sure that we're taking care of ourselves first. Like Swart said, that checklist, have I had my mammogram done this year? Have I, made sure that I've gotten my prescription filled, or I've taken this medication today? And if not, making sure that I take it before the end of the day. So just at the end of each day, at the end of each season, at the end of each week, at the end of each month, just making sure. I'm a checklist type of person. I have things in my calendar, but at the same time, I need to make sure that it is done and over with. So I make sure that, I have so many things as my health being that I have to make sure that I've accomplished every year. And I have a checklist for that. It's my skin check for, because I take immunosuppressant drugs. I have to make sure that I have a skin check for skin cancer every year. I have to have a colonoscopy every year for colon cancer screening. I have to have my mammogram, your dental, everything that you have to do, you're checking up. Because if I'm not able to do that and take charge of my health, I can't take charge of anything else for anyone else. Yes.
True.
Okay, so
it sounds selfish, but it's you have to take that responsibility for you. Those people that you're helping, they're taking from you. They're not necessarily returning to you. So they're not going to be able to be the one to be like, oh, by the way, thanks for the $100, but did you do this? Have you done your physical for this year? So you got to do you first.
You got to do you. You have to take care of you. Same thing as the thing you said. It's not the people you're sending money to who are going to take care of you. You have to take care of you. Thank you, ladies. Kendra, anything to add?
I mean, Miss Belinda and Miss Sword basically said it all. And listening to them in summation, knowing your body and, from making the checklist and everything that was said prior, advocating for yourself, right? There'll be a lot of requests. Growing up, I heard my mom on the phone plenty of times saying, okay, I'll send this, or asking, okay, Auntie Comfort, can I have this? So I'm very privy to that. And at some point, mommy was very, there was a routine giving. Then as she got older, I've seen it slow down, and eventually stop. But she advocated for herself once it became too much. So knowing your body and advocating for yourself and getting preventative care, not just waiting for emergency visits. Like prevention is better than cure. That's what mom always told me. So the preventative care is also very much important. And, I've also heard just getting rest. There's a lot of go, 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 as Miss Belinda was saying, with her two boys and just being a mom. And I'm kind of experiencing that myself and still learning how to manage being a mom and things of that nature. And I often have to know when to rest. And I feel like as immigrant parents or immigrant individuals, we just don't know how to rest, or it doesn't come naturally, or it's not as routine. So that to me is taking charge overall, making sure that you're putting yourself first.
Thank you. Adding rest to it. The chat is blowing. So greetings from Michigan. Being grateful and counting all my blessings. Have you taken care of yourself today? Have a checklist. Be 120%. Then greetings from Maryland. Sword, I'm very proud of you. So am I. You cannot pour from an
empty jar.
Yeah, empty. Yeah, and you first, and then you got to do you, right? I love that. Okay. Right. All righty. Okay, going on. So, Kendra, let me start with you because you're a first gen, right? What are some common health mistakes people make, and give it that immigrant bent immigrants make, and how can we correct them as we're going into 2026? We are all making goals, resolutions. Help us, give us one tip or two.
Yes, Miss Marian. So just in my practice, from what I'm seeing, it's just avoiding the healthcare or avoiding the preventative care and waiting till emergencies.
Mm.
That's the biggest downfall that I've noticed. Certain checkups and screenings and vaccinations, they're they're being missed and they're being skipped, whether it's because, we have families, we're always on the go, whichever. There's a lot of there's a lot of reasons why, but I feel like that's the main point where they only or where yeah, where they're only seeking help once it becomes severe.
Mm.
Sometimes is at a point of no return where it's just harder to treat. So that's the first issue, just skipping those preventative care actions. And again, it could be because of a multitude of reasons, excuse me, losing health insurance or just being afraid that you won't be understood as an immigrant. There won't be culturally competent providers or things of that language barriers. The reasons go on, or misunderstanding of the healthcare system. So it's just that's the main issue that I've seen in my practice personally is just they're coming when unfortunately there's a blockage in the heart, or they're coming when the foot is infected and now we have to refer for an
Amputated.
amputation,
Yeah.
whatever. So that's the main issue there. And again, there's just a stigma around as far as seeking care prior to when it becomes severe, and hopefully that could be broken down. But just
Yeah.
avoiding the care until it's an emergency, that's the most common health mistakes that I see immigrants make.
Yeah. Well, Kendra, you said something that I want to follow up on before we get to SWOT. Um, there are immigrant health professionals, and they
Mhm.
like if
Absolutely.
there are people that will be competent, the person might not even be an immigrant, but they are competent.
Mhm.
So how can people get out of that mold that there isn't anybody who understands me, who understands my language? How can they, what are some, if off the top of your head, resources that they can um, reach out to? For instance, SWOT is a mental health, psych mental health. Am I saying it right? She has a practice, right? But if Kendra can break this down for us, some more tips on how to find culturally competent providers.
Yes, Miss Marion. So I'll actually piggyback and go back when we discussed the total well-being and the community aspect being
Uh,
important. Once you formulate a community and you talk to people, you're networking, you're finding out more information. Hey, this person is, oh, she's also from Ghana. You can go to her. You don't need to go, she may have a little bit more culturally competence as far as, how to best provide the best quality care for you. So going back to your first question, as far as what total well-being means, total well-being, falling under the umbrella, or the community aspect falling under the umbrella of total well-being, I feel like that could certainly help
yeah,
and be a
yeah,
good tip as far as knowing the right provider to go to. But I know sometimes it's not always easy to find community, especially as immigrants, but I just feel like we can at least try or advocate for that so that we can talk to people and network and, get the best information and we're not operating on our own knowledge.
yeah. Or on ignorance.
On
Yes.
ignorance.
Yeah. Sword, anything to add on that front?
Yes. One common mistake I think is not checking our health. Like Kendra said, some of us procrastinate, especially immigrant. We said we'll get our appointment done tomorrow, and maybe the same day that you have that appointment, they call you to go to work, and you're going to work instead of going to that appointment. I think we have that. For us African, we use spirituality also in leaving it to God. I think we will say, oh, our grandparents, our great grandparents, our great great grandparents, we never went to the hospital, and they lasted for so long. So that's another thing that immigrant does. They will say something like that. And mentally, most immigrant neglect their mental health. I think sometimes the mental health itself trumps your physical. If you are not mindset, if your mindset is not okay, you cannot take care of yourself physically. So when you neglect that part, and that's a big part of us, in our community, you will not be able to take care of yourself. 2026, we can have all our important things together. We can have all our important doctors' appointment together. Kendra says something about preventive measures, making sure that instead of waiting for it to get that bad, let's get it checked prior. Let's make sure let's cut on our food, sometimes our food stuff. Let's walk. For example, for me, maybe 2023, I had a health scare, which got me to a point where I started taking care of myself a little bit more. I work a lot. I do not sleep. I eat odd hours. And someone came in to do a physical test with me due to insurance purposes and stuff. And this person was like, ma'am, your blood pressure cannot get down. And I'll say to myself, okay, what do you mean? And during that time, prior to that time, I had headaches back to back to back, but I ignored it. I'm up in the morning, I'm going into work, I'm trying to start my own business, I'm trying to do everything. I'm getting pulling from different places. This person was telling me, ma'am, your blood pressure is over 200. I can't get it. I said, what are you talking about? I don't have a blood pressure problem, and I start checking my blood pressure. And I was not even 40 years old yet. This is me having this type of issue. That scared me a lot, and I started taking care of myself. Since that day in 2023, I would never forget, it was early in 2023, maybe January or February. I talked to myself one night. I said, you have to take care of your own health. And the mistake I did, I think I was not even doing routine exam for myself. So I tell people all the time, and maybe I wasn't mentally stable. Even though I'm a mental health specialist, I was not. I was ignoring the fact that I had so many things coming in my life, and I'm ignoring my own personal health. So that scare got me to a point where I started seeing differences when I made those little changes in my life. So.
Okay. Belinda, thank you for sharing that story, Sword. Thank you.
Yeah.
Thank you.
Piggyback on what Ms. Kendra said there, that the community can be a great help. But also we need to be very careful in that setting, or maybe in the setting of just family and experiences and trust issues that people may have. People make the mistake of listening to the wrong information. Oh, well, then, and I'll give you an example.
Yes, do.
My dad lived in New Jersey with my stepmom and my brother some years ago. He had end-stage liver cancer, and he was having a lot of pain in his belly, and they were trying to tend to it from home and not going to the emergency room, because my stepmom's niece says, if you go with him not having a set insurance, they're going to send you a big bill. And my dad was suffering at home. And prior to this, I have been a huge advocate for my dad, and so then, when he got into New Jersey, we were still working on coverage for him, but then working in the hospital and knowing that there's so many different programs that help people, especially people with cancer, we're working on things like that. And they weren't communicating to me at that time, because I was also having a very serious life health challenges at that time. So it was like, oh, let's not bother her, so he didn't go to the emergency room. I mean, obviously he's still end stage, but we still needed to make him comfortable. So eventually they did go to the emergency room. And then fast forward, he's admitted, and he's pretty much, this is the end for him. It's the end for all. But we want to get him comfortable enough that we were hoping to send him to Ghana. And for him to be comfortable, and when God was ready to take him, if truly he was then, he'd be at home. So I walk in and I can tell that he was in a lot of pain. And usually by this time, they're doing what's called comfort care. And there's certain medications that they will give him. They'll give him something for his belly because, they tend to produce a lot of gas towards the end stage. And then usually the biggest thing is to run a morphine drip to help them be comfortable, because at this time, it's hard for them to breathe. They're in a lot of pain. So I asked the nurse, why is he in on, a continuous morphine infusion? And said, oh, your stepmom refused. And I was like, what? So then I asked my mom, and she said, oh, they said that, once they give them that, they're pushing them to death. And I said, they're making them more comfortable. It's inevitable that will come. But who wants to see their loved ones pass away in pain? And I was like, okay, I'm not going to get into that. But I knew that there could be an alternative done. Instead of a drip, we give small boluses, to get him comfortable. And you won't believe that the first bolus that she gave him after that, he seemed really, really comfortable, where, he opened his eyes once, he smiled, he looked at us, and shortly after that, he passed, and just listening to certain things will prevent us from getting those preventative, oh, you don't need that, or, oh, you can wait, or, oh, I went this and this happened. We may not have good experiences, but that does not mean that that's for everyone. And so just the mistakes sometimes we can make is listening to those things and not making the right choices after hearing that. You go through it, if you might or may not experience that, and that's not for everyone. So we need to make sure that we're making those decisions for ourselves. And I think another mistake too, we don't seek help because maybe we might be undocumented or we may not have insurance, but there is so much out there that can help us navigate through all of those things, and at minimal cost to us to be able to get those preventive health that we need.
I don't know whether I'm crying or I'm just taking, thank you ladies for sharing these stories and just giving us tips and ways to take care of ourselves, and things to do, things not to do. Let's just move to the next question that I have, is that if you can give us 2 to 3 small lifestyle changes we can all start with, whether it's food, whether it's rest, movement, stress management, any 1 or 2. So once I see you smile, I'll call you first. So I'll go with you. But whilst you're thinking about the question, let me look at the chat. As immigrants, okay, so start the community if you can't, start the community if you can't find one. Another question, in addition to routine medical checkups, have a routine for personal physical health, physical well-being. Stop procrastinating on simple things like exercise. Okay. As immigrants, you have to believe in your own. You have to believe in your own, meaning I have to move this thing because I can't. My glasses, I'll change my glasses. There's another comment: effective communication, proper support system.
Yes.
Yeah, there's more. I'll read it. So let's start with that. I need to change.
It's always good making small changes and to accomplish something bigger. And one big one for me would be resting. Take time to rest. I think some people think sleeping is optional. It is not. It is not optional for immigrants. We work long hours. Sometimes you do work 16 to 20 hours and you get 2 hours of sleep. And then you go back to work for another 8 to 16 hours. It would just get you into a panic mode. I think most people don't. I have a friend of mine that has issue with sleeping, and I always tell him, if you don't sleep for a while, one day the sleep is going to catch you, because sometimes sleep don't even know where it will get you. It will get you while you're driving. It will get you while you're sitting down, maybe having this important information right now, and then I'll be sleeping through it. So it will get you in a point if you don't take it. Eating also can impact in our eating correctly. So the time that we eat is contribute a lot. And for me personally, I do have that issue. I had that issue before when I would get up at 1 o'clock or 2 o'clock in the morning. I can't eat. And then you go to sleep, then you wake up again. You know what the amount of calories you take in. So those small changes, if I used to eat, nowadays my friends will tell me I'm eating in a cup because I'm measuring what it is. I wasn't. So resting, those changes rest. You eat correctly. You know the amount of food that you eat. Personally, I think people struggle, and I hope that we can overcome that. And making those changes, just take those little steps, just rest, eat correctly. I think those two things for me is one of the biggest thing that impact my own life. So that's what I'll start with.
Okay. So yeah, speaking to me, I know there are a few friends who have been telling me rest, sleep. So sword and professionals. How many hours of sleep should we have? I have a brother. I don't know whether my brother Richard is on, but he works on a ship. So he has a completely different schedule. But for those of us who have sort of regular routines, how many hours ideally?
Day. A day between 6 to 8. Even though people do not, that's just me. Some people don't have that enough time to sleep. You have to take those rest because it accumulate. If you do not sleep, um, if you sleep like 2 to 4 hours every day, at a time of your life, you or during that period, you will have time where you sleep maybe 12 to 14 hours. And you ask yourself, oh my God, why? Because you've been skipping those hours from sleeping. So it caught up with you. So for me, I'll say 6 to 8 hours. The most you can sleep is to make sure just to get your body into a mood for your active mood for the next day, for days to come. So
okay. Yeah. Thank you. So I heard you rest, sleep, eat correctly. Okay. Kendra, to you, and then we'll go to Belle. Any 2 to 3 small lifestyle changes, like Sword said, and it said a journey starts with one step. A marathon starts with, just small. The first you have to make. So any 2 to 3 small lifestyle changes that you can share with us.
Yeah, I really think Miss Ward hit the nail there and was very spot on the small, but we just have to maintain consistency. A bonus, personally, would be prayer and meditation if you don't have somebody to pray to or a belief system to pray to. Prayer and meditation, and though that's just something again to help with taking back your mind, or just making sure that you really take the time to ground yourself, to hear from whatever source. I believe in God, so I'm going to say, making sure that I'm giving myself time to hear any messaging from God. Meditation as well, deep breathing. Sometimes we don't stop to just breathe, and that's what really meditation has helped, as far as just allowing just to deep breathe and making sure that we are able to reflect and really be in tune with what's going on with our body. And not only that, research has shown that meditation, prayer, deep breathing, it really helps to calm the nervous system. So that's just a bonus, in addition to sleeping and resting, like Miss Sword said, and eating the appropriate meals. And that's a bonus in addition to those things. And I always tell my patients, movement is medicine.
Movement is medicine.
Mm-hmm. Yes, and yes, Miss.
It is.
So,
It is. It is.
So if you didn't get it, Kendra just called me auntie, which is fine.
even even if it's just 10 minutes a day, again, we just want to maintain consistency. It's not about the intensity, it's being consistent and just making sure just once a day, just 10 minutes, and then Lord willing, as your body is feeling good and you're feeling the effects of that, you can increase it. But 10 minutes a day, movement, small walks, a dance, movement, moving your body in some capacity, I've seen can really improve the quality of life and increase the longevity
Longevity.
of individuals. So that's all I'll add.
Good. Movement is medicine.
Medicine.
Honestly, can you guide us through maybe 3 breaths?
You said what?
Can you guide
Through
us
breathing.
through breathing? Everyone, wherever you are,
Yes.
just take a deep breath.
Just
Yeah.
take a deep breath
Mm-hmm.
and release it. You do that about 3-4 times.
Yes.
It's just really, really just
Really calming.
calming. Yes.
Okay.
Count to 10 backwards, 10 to 1, breathe. That really can be a really stress reliever.
Good. Thank you. Anything to add, Belle?
I'll piggyback real quick on all 3 things that they mentioned. Obviously, we said diet. And I'm going to say, for us to avoid sugar. And this is huge, but can be it's a small thing, but can be a very big and huge outcome. I've known people who have stopped drinking sodas and have lost tremendous amount of weight. It's hard because there's sugar in everything that we consume. But just going down a little bit. If you drink coffee or tea in the morning with sugar, maybe try doing it without or taking less each and every day to a point where you don't anymore. I love coffee with creamer, but I can also do black coffee, black tea when I need to. I do have periods of time where and ever since my liver transplant, I came to learn that my the person's liver that I got had a sweet tooth, and I kind of believe sometimes you take on some characteristics of that individual. So I do like sweet things, and I have to at sometimes come to a place where I go on a no sweet diet where I just completely cut out for a certain amount of time. But for me, it has been just a slow progression and taking smaller and smaller and smaller amounts. As Africans and as a Ghanaian, we eat a lot of carbs and we eat rice as a main dish. I've gotten to a place where rice is more of a side, where it's like a spoon or two, and then I mostly have vegetables and a protein. So it doesn't have to be like an end all, because when you do that, it's hard to maintain. So small changes as you go along. Also, as Ms. Kendra mentioned, you don't need a gym membership. Just walking. It's amazing what you can do just walking up to 30 minutes a day, a few days a week. Some of us may eat at our desk while we work. For mental health, it's always good to just detach, even if it's for just 30 minutes from your work environment. So that means that get away from the office, get away from the computer, get away from whatever it is that you're doing. For me, it's going outside and walking. I walk 30 to 40 minutes, if the weather permits, outside every single day, Monday through Friday when I work. I might eat at my desk, or I take just 10 minutes to eat, and I take the rest of my time and I walk. There's a walking path around my campus at work, and I walk a mile every day. And that's just amazing. It helps to keep heart healthy. And then lastly, touching back on sleep, even though you may just be doing 2 to 4 hours of sleep, try to find a day or two in your week. Maybe it's a weekend, a day that you don't work, and really make up for that. That rest is not just, that you don't feel sleepy. At the end of the day, it helps cells turn over. It helps brain power. It helps your body refuel. There's a lot more things that happens when you sleep, not just rest, that your body needs. And if it doesn't, you're increasing your risk for heart disease, for heart attack, for things like that. We Africans, and we tend not to do vacations. Take time for yourself and detach, and find rest that way. There's studies that show that people who take vacation versus people who don't take vacation tends to have more heart attacks.
Hey, I have to go on a vacation. This is serious. I need to. You've said some very serious things, but doable, small
Yes.
steps. But Belinda, this sugar thing is making, somebody said, oh Lord, not the sugar. So no puff puff. I think I'm asking for a friend. No puff puff, no cake.
Have puff puff. Don't have it every weekend. And if you have puff puff for that week, that means that you're not putting creamer in your sugar in your thing. You're not eating 2 servings of fufu that week. So like cut off. My big thing, I love Nkati cake. What is it? Peanut butter brittle, and I make it myself. So I have a little bit every other day. You know, and then that week I really don't have much of anything that has a lot of sugar. So I'm mentally thinking about it. I'm working. I'm working. I like ice cream, but I'll have ice cream maybe like once a month or once every other month or something. I don't cut things out like doesn't make sense and I'm craving it. Then this way I'm gonna have it like a lot. I make puff puff, I make pound cake. I love pound cake. I love apple pie with ice cream. Thanksgiving, I had it 3 days in a row. But since then, I have not had anything that's sugar. So and then I don't have a whole pie in a day, or I don't eat a whole pint of ice cream. So in small amounts, and not every day. Find ways to just maybe incorporate something else instead of that.
Okay. Swat is smiling. You made me even lose my question. And I'm also looking at the chat. I have absolutely movement is medicine. Start with walking. And I know the person, he's a footballer. I have Edie said moderation. Abigail from Canada is saying that's right. Walking 20 to 30 minutes a day, walking, set a daily target. Oh, this is really resonating with people. But I have a whole bunch: rest, sleep, prayer, meditation, ground yourself, deep breathing, movement is medicine, consistency. It might be start with 5 minutes, 10 minutes, and grow it. We are not saying it, cut it all at once. So Belinda is saying, don't eat your puff puff is like African donut. For those of you who don't know, it's a dough that is fried. But even if when you're making it, you can actually start reducing the sugar, right? Yep. Okay, this is so good. Please, why don't you show some love in the chat, give some emojis. This is so good. I will still ask this question, even though you've addressed it. Many immigrants, including myself, many people have fear or anxiety, what we call the white coat syndrome. That is, you go, but you have that white coat syndrome. They have to take your blood pressure twice. Why does that happen, and how can we overcome it? If you can each give me one tip, and it can be just one tip from the three of you, how can we get over that white coat syndrome? And I'm so glad you didn't wear your white coats today.
I think we all have it. Everyone has a little bit of it. I have patients who come in, and as soon as they pull up to the door, they start to want to vomit because of just knowing that chemotherapy will make them vomit, or have nausea. So give them a steroid and give them an anti-anxiety, a small dose of Ativan prior to treatment, or some steroid prior to treatment to help that. Now, outside of medication, again, that's where some of these meditation and these breathing exercises, we also teach them non-traditional, non-pharmaceutical things to do. While they're there, we do have like those who like to knit or coloring to help take their mind off of it. For me, it's my blood pressure. My blood pressure is ridiculously high when I'm not ridiculous, but high when I'm in a doctor's office. So I do it at home. And even doing it at home, there's a way to do it where it decreases the anxiety. You don't do it like multiple days a week. There are times where it's best to do it during the day, and then you do it a few times a week. You either record it or get the machine that would keep a record of it. Okay. And then, a 2 week, 3 weeks, you send it to your doctor, or you take it with you. So when you go to your appointment, I've had it where they would turn the machine on to take it every 5 minutes, and they walk out of the room. And even just them walking out of the room makes a difference.
Oh my
in the
goodness.
pressure. So, you know, if it seems high and they want to put you on medication, but you know it's not high, you can check it at home. Checking at home, there are ways of getting a blood pressure kit at home for free that you don't have to pay $20, $30 at home. If you need help getting it, reach out to me. I'll help you find things that would allow you to be able to get that at home to check your blood pressure at home. So things like that, again, meditation, breathing, outside of, you know, taking drugs to prevent those things, but those are some ways to kind of come back. But it's really, it's a thing.
It's
And
a thing.
it's not much you can do about it, but there's certain things like, but once even if your provider is aware of that, there are ways that they can do, especially as one big thing is blood pressure. They don't check your blood pressure as soon as you walk in. Some of them wait to the end of the appointment. This way you've kind of settled down, you've come down, you know, here you are trying to hurry up, make the appointment, you know, parking, running, and then you go sit there and they take your blood pressure. It's going to be high. It's going to be high. So maybe taking it at the end or even taking it again at the end before you leave, because once you're leaving, you're excited, you're ready to get out of there. Your blood pressure will probably be a lot better.
You ladies are just amazing. Amazing, amazing. There's so many. I probably need to take a picture of this emojis in the chat. So many love signs. Thank you. Consistency will trump all. Okay. Anything to add on the white coat syndrome?
I think it's fear of the unknown.
Mhm.
So most people think that, oh, I'm going there and I'm going to get a news of something that I might not like.
Mhm.
We fear a lot. And that's what gives that. That's what gives your blood pressure to be high. That's what makes you anxious. So, and one thing that we said earlier was building that community. Get your provider to be a friend. All right. So when you're comfortable enough to know that, okay, I'm going to see one of my friends today. And that's another thing we can do. Instead of saying, oh God, I'm going to see her, she's going to tell me to put, or he's going to tell me to put me on another medication, or I'm going to have that I always have an issue with my cholesterol is high when I do labs. So when I go there, I'm always anxious, like, okay, what is the level today? So instead of having that, just get that appointment and say, you know what, I'm going to see a friend today. Don't think about the bad part of it. Think about, okay, this is something to prevent me from being this way. I think when we think about it that way, we will not have that.
Yeah. So I'm hearing that mindset shift.
Yes.
A little mindset shift. Thank you for that. Kendra, anything to add?
It was all said, Miss.
All said.
You know, again, practicing exposure versus avoidance. Miss Belinda really said, you know, if you take it at home, when you get to the office, it's not too much of a shock. You know, if you can go to CVS and buy a blood pressure cuff machine, you know, make sure you're routinely checking at home so that, you know, it's not something that's so foreign to you. And then I always tell my patients, again, like Miss Belinda said, arrive early, 10 to 15 minutes. And when you arrive, you're sitting, you're not on your phone scrolling. Don't look at any stressful emails or text message. No, put the phone down, arrive early, deep breathe, and really relaxing your nervous system prior to taking it so that, you know, we can get the accurate reading and you won't be able to be so anxious about it.
Thank you. Thank you. Thank you. Thank you. If you're enjoying this conversation, you're joining us for the very first time, you haven't subscribed to the channel, one little favor, you help us by subscribe, like it, send it to somebody who needs it. I mean, this is incredible. It's an incredible conversation from three powerhouses, combined experience of over 50, 60 years. So thank you. Now we're going to get into very specific topics based on their specialties, right? Belinda, you are a pharmacist. So let's talk about medication, treatment, literacy, advocacy. And when I'm talking to you, and I remember some of the stories you told me, but let's get to how should people, generally, and immigrants, what should they know about medication safety, especially when combining prescriptions, herbal remedies, or medicines from back home?
Right. Medications, for the most part, being in the US and having a body of the FDA, we know that medications are generally safe, but they're only safe when we take them the right way. So you get your medication from, your CVS, your Walgreens, your Giant. Ask questions. And my nursing colleagues here would agree, we have something called the five rights, the right drug, well, the right patient, the right drug, the right route, the right time, and the right dose. So we want to make sure that, this medication is for
Can you say it again?
The right patient, right drug, right dose,
Right
right
time.
I have it right here, and right route. So is it taken orally? Is it an injection? Is it for the rectum? So we have to be, most medications that we're taking at home is orally. So we want to confirm, making sure that, your doctor is giving your prescription, what it's for. It's, most of this information is going to be written on your bottle. But if you have a question, you need to ask. Now, again, the medication will work well depending on, the type of medication. There's reason why we need to take a medication on empty stomach, because, the acid helps it to metabolize better, or when we have to take it with the food, or when we have to avoid taking certain medications around when we take our certain medication because of interactions. It's important that, we take it in the morning versus the night, because, again, they're made in certain ways. And so, when you're told take it in the morning, I mean, don't take it at night, but because maybe you missed it today, take it at night. The other thing too is, don't share your medications. Just because I have this blood pressure medication and so says, oh, their blood pressure is high, that you think you can share. I had a patient who was using their sister's insulin, but it wasn't the type of insulin that they needed. So their sugars kept going higher and higher and higher and higher. So, one fit doesn't always work for all, although yes, as people of color, a certain type of a certain category of blood pressure medication works better for us. Doesn't mean that, there's risk and benefits that we need to look at, so that your medication is for you for this particular thing. Take it when you're supposed to take it. The one thing that I think people run into, like, if it's they want to feel better, especially like antibiotics, you're supposed to take it twice a day. They try and take it 4 times a day. Do our best to take it as it's been written and to try and finish that medication. Now, you have blood pressure medication or cholesterol medication that you're not taking it properly, not taking it every day. You get your labs repeated, and the doctor says it's not better, so we need to add another medication or increase the dose. But we're not there yet because you're not taking it the way that you should be taking it. So that's very important for continuity of care. We want to make sure that we're taking our medication. Trust me, like, you're gonna miss something. We're human, but the best way to also make sure that you take, especially if you're taking more than one thing, is to use a pill box. I take several medications a day. I have a pill box and I have a reminder on my phone. So every time I do go on my phone and it's 9 a.m. and I haven't taken it yet, then I know that's a reminder. And by 9:30, 10 o'clock, I've taken it. Another important thing is to ask, what do I do when I miss the medication? Like, do I take it right away? Do I wait to the next dose? That's also all important depending on what time you miss it. So, pharmacists nowadays are not like the way that they were before, with it, your CVS, right? They're always trying to push out prescriptions, fill. They're encouraged to talk to their patients. We have databases that we can look at drug interactions and look at the herbals and the meds from home. Surprisingly, we can make out certain things, and certain things are in that system that we can check and make sure that, so it's important to tell someone, all the medications that you're taking, even some of the ones from home, with some description, we can be able to find out what it is, so as close as possible, and try and see and make sure that it's not interacting with your medications. What else did you ask?
Oh, no,
safety,
I was it.
combining. Yes.
Yeah.
So, and they should have time to do this for you. They may not at that right moment and be like, oh, can I call you with that information? But just make sure you get that information to your satisfaction.
Okay. Okay. So let me ask this question. I want to ask a question about advocacy.
Mhm.
For some of us, where we are coming from, you can't ask questions. Your doctor says this and that's it. You can't even, I mean, you know what I mean.
Mhm,
So
mhm.
how do we build that muscle to advocate for ourselves, to ask questions, right? We don't know. We have to ask, right? How do we build that muscle? And then let me ask the other question. One big red flag, that means someone should talk to their pharmacist immediately. Maybe you can answer that and then end with that advocating for ourselves.
Sure. Red flags, we have something called a side effect, and then we have something called adverse effect. So adverse effect is more so like an unexpected effect that can happen with the medication. Side effects, we mostly might know. Okay, so you're taking an antibiotic and probably you get a pain medication, after you had a procedure, you're gonna have some nausea with it. That's in side effects. That's expected. And then you have an antibiotic for something, and then you break out into a rash, your throat start to swell. Now that's an adverse effect because we didn't really know that this can cause. We know that it's a possibility, but we didn't know that this will happen in you. So then, when these things happen, reach out to the pharmacist, reach out to the doctor's office. That's why when you go to a doctor's office, they ask you, do you have any allergies or do you have any, with allergies, if you're allergic to penicillin, they're not going to give you something that's going to cause something to happen once you take that drug. So also your pharmacist will be able to determine whether having nausea with a pain medication is really a reason why not to give you that again versus a true allergy and not to give you that medication again. So it's very important that when don't be shy about you felt a certain way with the medication and just stopping it. That's not going to help you. So it's, talking to your doctor's office, talking to your pharmacist, letting them know what the experience was, and then they can move forward with whatever else needs to happen and change the medication or be like, oh, it's a side effect, it will pass away. If it's an adverse effect, like an allergic reaction, then we know not to give you that medication again. And it's important to make sure you have that information. Keep a list of your medication. Again, if you take more than one or two on your phone, and always make sure that you give that information to your provider so you don't end up having something we call polypharmacy. You're taking 5 different drugs for blood pressure when you really only need one because this doctor office doesn't have this as part of your profile. Then as advocacy again, a big thing is making sure to advocate for yourself, to make sure that with each and every provider that you have, they have a current up-to-date list of your medications, a current list of any side effects that you've had, any allergies that you've had. And be bold, speak up, oh, I already have this blood pressure. Why this? Oh, okay, this works a little differently. Your blood pressure has not been where we need it to be. This works this way, that works that way. And together we can get your blood pressure down. Just because they say start taking a new medication, you want to know why, you want to know how it works, you want to know how it's going to affect you, you want to know, all those different things. Now, if you don't speak up, advocacy is just speaking up and speaking up for yourself, because that doctor is not going to advocate for you. They might, but you are your own best
Advocate.
So it's like, question things. The moment you start questioning, providers are not trained to kind of, come to work and not give you all the information. But the moment you ask a question, it could have been in the back of their mind, but they forgot or it didn't come to them. It prompts them to open up the dialogue, to open up the conversation. And I don't think you'd be scolded, maybe from where you may come from, that's not a thing. And maybe doctors or providers are held up to a higher standard, so you can't question certain things. This is your health.
Yeah.
So if you don't question it, who's going to question it? So definitely, and if you can't do it, like I have an aunt in California who has a nerve pain on her side and a nerve damage. And they keep changing her medicine. One day her son was like, "That's enough, mom. I'm going with you." And the moment the son went and started asking questions, like, "Oh, yeah, you know what? Well, we can try this, or surgery sometimes works. Let's look at." I mean, it just took her son asking a little bit more question and just pushing just a little bit. So I think just asking the questions to be able to advocate for yourself. Again, it's not because they don't know, but just to push the envelope a little bit.
Yeah. And I heard something here that if you have an elderly parent, go with them.
Yes.
Right.
Yes. Even if you can't physically be, this day and age, I see a lot of notes from providers. Oh, daughter is on the phone. Daughter dialed in to the appointment, or gave a number of questions, and then the daughter wants me to call them back. I call the daughter and answer these questions.
Mhm.
And so then being on their medical record as being someone that they can speak to, because now HIPAA and privacy and stuff like that, unless you are on there as a person that they can speak to. I'm on my husband and my kids thing, as you can talk to me, I can make an appointment, I can ask a question for them. So you can call and be like, "Oh, my mom came to see you. There's these new meds, I have questions." That's another way that you can advocate for a loved one.
Ooh, I'm feeling so smart sitting here, so full of myself right now that I know the difference between side effects and adverse effects. Thank you so much, Well. And Kendra and Sword, is there anything you want to add to what Belle, anything she said that you want to highlight or double click?
Yeah, I really enjoy what Miss Belinda said, as far as having somebody there with our elderly patients, somebody that could further advocate for us, even like FaceTime. I'll have my elderly patients have their family members on FaceTime and things of that nature, so that it's documented that they are a person that we can continue to speak to best advocate for the patient that we're treating. So I really enjoy that a lot. And I feel like that's very important, not to forget about our elders or forget about our mom. Let's make time to go to the appointment with our parents.
That's true.
Or grandma.
Thank you.
Yeah.
That's great.
Yeah.
Sword.
Taking care of yourself is what we're talking about today. So being an advocate for yourself, anything I ingest, I have to know what it is. I have to know the side effect of it. So being able to ask the doctor, a provider, you can, I tell providers do not have horns on their heads. Some of them need research and tell you exactly why they're giving you. So being able to advocate for yourself and ask questions for every medications you take. And I think that's another thing that we do have in nursing school, as growing up as a med aid, a nurse. They tell you, when you go in to give a patient, tell them you have a cup of medication. This is for this is for that. Explain to them so they will understand. I work in long-term care, so I know sometimes some long-term care, we have patients with dementia and stuff. I know they don't understand, but you want to tell them, this is what you're getting. You're getting a blood pressure medication, and sometimes the side effect is this, that, and that. So for me, in management in long-term care, I advocate a lot for my patients because they're not able to advocate for themselves. So advocacy for me is really big.
Mm-hmm. Yeah. Oh, good. Any questions for them? Let me see. I'm getting comments in here. This is very informative. Thanks, ladies. Awesome advice. Free consultation. Many thanks, sisters. Especially advocate, especially for our elderly people. Which arm gives? Okay. Oh, there's a question here. Which arm gives the most accurate blood pressure reading? In Ghana, they mostly check on the right hand, but I think other countries check on the left hand. So one of you can answer that. And then there's another question, the comment. Let me read the comments while somebody, I've been there. Victor Forson says, I've been there. Please ask questions if you're unsure about your medication or what your doctor is saying. We need a community for this. Okay, so thank you. Keep the comments coming. The comment was, which arm gives the give the most accurate pressure reading? Any of you or both arms work?
I think both arms work. But I do remember both feet have to be on the floor. And I believe, ladies, correct me if I'm wrong, the arm should be above the heart. You know, a lot of times you take the blood pressure and your arm is down there. You know, it should be kind of on the table and a little bit up. So yes. So those who are taking it at home, make sure that, you know, you have your arm up above your heart, your feet are flat and, you know, a little bit apart, not crossed at the ankles, not, you know, crossed at the knees, but yeah.
I agree.
Okay.
Each arm, I don't believe there's any specific arm that's better than the other, but just making sure that the right technique is being used in addition to the right blood pressure cuff. If you're a larger person, don't use a smaller blood pressure cuff because it may give a higher reading. Or, you know, if you're a smaller person, don't use a larger blood pressure cuff. That'll also give a reading that's too low. So the technique is very important, but I don't believe that arm really matters. It's more so technique and how you're sitting and things of that nature.
Okay, so technique and posture.
Positioning, yes.
Yeah, that's I know. Okay. I hope that answered your question. If you have any question, put it in the chat. Okay, there's a comment here that's making me laugh. It's the colonial master's way of thinking. I don't know. Then there's another comment. Doing background checks on the medications the doctors prescribe can also give us more insight.
Right.
ChatGPT or Google can shed some light.
Yeah.
Yep.
And ask questions. Okay. Thank you, ladies. We are getting smarter and wiser, and we're going to take charge of our health and well-being this 2026. Now to you, Sword. I have a few questions. What are signs of stress or anxiety that people often ignore but should not?
Stress and anxiety have many symptoms that resemble each other. You know, you can have elevated heart rate, a racing heart rate, problem with sleeping, irritable, you lose focus easily. So that can be signs of either stress or anxiety. Anxiety just always involves persistency. So when you have excessive worrying about future event, and then while stress is just a reactive to something specific, it's a specific thing that manifests on us physically and in that person. So increased tension, your heart, you have a headache, digestion issues, you know, stuff like that is a very overwhelming. You're very overwhelmed, you're restless, you're tense. So those is like an interchangeable symptoms that both stress and anxiety have. Most of these signs are ignored because they either go away for some time, and the factor that does trigger the issue is not there. So, but knowing that there is an underlying issue, when these things start repeating itself, when these triggers start coming back, that's when you think you need to have a professional help. So it is not something to just let go and saying, oh, okay, yes, because this happened. So most times stress will trigger you to have anxiety. It will trigger you to have so many other symptoms. And I said, sometimes I talk to my patients that there's an underlying issue. Most people go in and say, I have anxiety and I need something for this medication, but I need a medication for this anxiety. And sometimes when you take those medications, they do help at time, but when you have some underlying issue like major depression, when you have major depression, some signs that comes out is anxiety to a point where some people get so quiet by being depressed, and some people get really anxious and things like that. So for the issue we ignore is because they come and they go, and then we ignore it, and then after a while they come again. But if it's something repeated that is happening to you, and you know that this is not something that you control, because some anxiety will get you to a point where you're not able to control yourself, so you need to seek professional help.
Okay. So can you give us a few quick daily mental health practices that busy immigrants, busy people can use to stay grounded? There's busyness. I'm working on mine. And so please.
So every new year, many people make plans, right? We do make plans and say, we're going to change something. We're going to improve something. We're going to change some aspect of our life. But half of the time we fall flat, just because of one thing. And that thing, I think we talked about it throughout this session, is inconsistency. We're not consistent with it. We make the change and we don't get consistent afterwards. So for mental health, is a quick impact on a couple of steps that we need to incorporate in our daily routine to make us mentally sound and to keep our minds together, such as just maintaining good sleeping habit, having sleep schedule, and just keep it up. If you know that you were sleeping 4 hours and you want to get it to 6, you want to make sure you get 6. Time yourself. Say it, okay, this time I'm going to sleep 6 hours. I'm going to make sure I get that 6 hours rest to get my mindset. Prioritize your to-do list. If you have a list generally ready for you to maintain your health, keep it consistent and hold on to it. Hold yourself accountable to it. Make time for yourself to release stress. Take time to blow off some steam, because sometimes we do, or we all have that time that we need to blow off some steam. Take time off, relax, recharge. I know Kendra said one of her hobbies is to travel. Some people like traveling, and I love traveling too. So, and every time I come back from traveling, I have a different aspect in life. I'm like, okay, what next? I need to do something else. I have different energy. So take that time. Have simple pleasure. Incorporate it in your life. I like candles. When I want to feel relaxed, I light candles. I enjoy lighting candles. I enjoy laughing with people that I love. So if you know somebody that is not stressing you, somebody that will boost your confidence, someone that you enjoy time with, light your candle, talk to that person, set. And then there's another thing that I always tell people: you need to set boundaries, for your mental health. Communicate your limit, especially personally and professionally. What you cannot take, don't start it. It may prevent stress and healthy life balance when you do that, and it prevents also burnout. If you cannot continue with this, don't start it. Just go ahead and set boundaries. Sometimes our professional life, we don't. We take more. And for once, I have that issue. I am learning from it. Whatever I just said, I'm working on it personally. So we need to have that. Lastly, self-reflection. Make time to reflect on your mental health. If you notice any signs of stress, just like I spoke about anxiety and stress, consider readjusting your routine. If something you're doing routinely that is giving you the stress, that is making you anxious, that is making you feel some type of way, just slightly adjust it. See if it works, before you say, okay, let me go to a mental health professional, because which we immigrant do not do as much. But before you do that, try to do some stuff, because when you come to me as a specialist, I will first ask you, have you done things? What do you do? What do you do to make sure that this is not working? What have you adjusted? Self-reflection can help you catch those problems, and they are small, and make those proactive change to just address your needs. If you do that, those are little things that you can do to help your mental health.
Oh my goodness. That consistency is coming up. Consistency. Schedule good sleeping habits, right? Simple pleasures, set boundaries, self-reflection, which we don't take time to do.
We don't.
Oh my goodness. Good. Anything to add from you two ladies before we go to the last question for Swad?
Just real quick, the travel thing, just getting away. you don't have to go to Paris. You don't have to go to Cancun.
Canada. What about Canada?
So you know what? Because again, it falls into finances that can lead to stress.
Yeah.
Yes.
But it's amazing. We live in Maryland, and within 2 hour drive, you can get to so many different places. Within 3, you can get to New York, you can get to West Virginia, you can get to Pennsylvania, you can get to DC, you can get to
Virginia.
Virginia. And I mean,
West
a day
Virginia.
trip a day trip to somewhere you haven't been before. Even just DC has so many things that you can do.
Yes.
So no matter where you are, I'm sure you have not explored all the areas there. So again, it's not something that's going to break the bank, or that you not need to go put on your credit card, or something that you have to now go save for. All you need is gas and tolls, or maybe a night, just a night's hotel somewhere where you can just go, even if it's just you and your husband, you and your children. You haven't done something like that, so people think of vacation as they have to, fly and go somewhere, but just explore your local area. Just even going to maryland.gov, you will find so many things to do just in that area, and just something to do to just minimize that stress and rejuvenate.
To add to that, I know years ago, well, maybe not years ago, a couple of years, I always have my friends do a day trip, just a day, find a nice place in Maryland. I know I have family friends that work in nursing. And nursing is kind of stressful a little bit. When you take care of anybody else in life, the healthcare is just is stressful. So I said, one day, just one night, we go to like a place where we sit, we go out, we eat, and we stay sometime in a hotel. Even if in the middle of the winter, we'll stay in a hotel, but we'll find a hotel that have an inner pool. We'll go in, we'll laugh, we'll release that stress. Coming out of that, just that one night, one day, you can see how relaxed we are. So, I agree with what Miss Belinda said. It is not about going to Cancun. It's not about going to Canada, Miss Marian is saying, but
There's Canada in the house.
just getting that one day just to get yourself mentally set. You feel some type of way when you do that. So I used to do that. I stopped. Maybe I need to start again.
Yeah.
And just go, just do that one thing for me, just for me and for us.
Oh my goodness. Let's get to Kendra. I want to read the chat. I know that we have addressed the stigma, cultural stigma around mental health, unless you have something to add. But I think we have addressed it. What do you think, Sword?
Mental health stigma in community is, we talked about it, but it is something that I think we need to get out of. We as immigrant, we need to make sure that it's not a taboo. It's not for us to say. We have this thing that we said, I don't know if you have it in your own country, they said your village people are taunting you, or it is the reason why it's not saying that you are, what will I say, you're a crazy person. Because when we think of mental health back home, right, we think of it's crazy people. We always have a place for them. This is where people go. And mental health illnesses are highly stigmatized in our community, meaning people do not talk about it a lot. And for what I see is growing in our community with our kids, I have seen a lot of little kids, like kids in elementary school, kids in middle school and high school, take their life, which I have seen. I think is for the past 5 years, I've had 4 or 5 kids that have done that. And one of them was, well, 2 of them was my own daughter's friend, closer friend. And it so impact her that you don't know how it is. And I think they don't get the education more. In schools, we have to teach about mental health, not only in here in the United States, we also need to broaden that in our countries. And Ms. Belinda said when you went to Ghana, you saw that. And that's a huge thing that I need to know, even in my own country. I have not been there for a couple of years now, but that's one thing I always want to take back, to make sure that we know that mental health is not only just the crazy people running around that we see. Is me and you, because I will have some anxiety, and I have anxiety, I will have depression. You will not know. Patients that I see that you will not know they're patients. So I think we need to teach those kids, we need to make sure they are aware of it and reporting it. One thing my daughter had was saying, Mommy, she talked to me. She told me she was going to do something. I didn't tell nobody because I thought she was joking. And this kid lost her life. So that one got to me. So she doesn't know a lot. And I wasn't a mental health specialist during that time. I was just a mother being there for their daughter and seeing her go through that. So we need to make sure some of the way we can reduce this stigma is just adding that education, just adding that mental health education in our community, adding that. Talk to your child. Most kids in the US will talk to their mother. I'm sad. This person make me this, and us Africa will ignore it. I've been sad all the time. I went to school. I still got my law degree. I still got my health. Okay, I know you did. But now this child is telling you how they feel. This child is telling you, I need you to fix that. I need you to look into what they are saying, because what they're doing, we live in a world that is not what we used to before. So what they're going to do, you will not know. Talk to them.
Don't minimize what your children tell you.
Yes.
And other children tell you might be teaching, you might be in Sunday school. Pay attention.
Yes.
Woo, woo. Let me bring this so that I can read the comments for you all. That people are scared. Okay. I'm trying to get as many in as possible. Doing background checks on the medications the doctors prescribe can also give us more insight. ChatGPT, Google can shed light. Okay. Thank you for the advice and information. A wealth of knowledge given today. Thank you, ladies. Letting the patients know about the medications. This Aisa too, yeah. Letting the patient know about the indications and contraindications is quite crucial. Have a friend who is currently experiencing adverse effects from the medication she was given without knowing. This is quite an educative discussion. Many thanks, ladies. People are scared of mental health due to the lack of what it really means or the negativity attached to it. Thank you. Very informative. Thank you, ladies. It helps. Thank you, ladies. It helps a lot. Going fishing. As long as I go fishing, it helps a lot. Yes, Canada is just across the border. Yeah. Okay, Canada, we are coming. You can also call a friend to have a good laugh. Canada road trip downloading. Let them know nothing is off for your children. Let them know nothing is off limits for discussion. African parents, exclamation sign. Oh, thank you for engaging today. We have our last round of questions. Maybe so. Kendra is a family nurse practitioner. What annual checkups or screenings should adults prioritize in 2026 by age or gender? I know you can't go through all, but give us some key ones.
Yes. So just generally for all adults, blood pressure, check those blood pressure. Hypertension is a silent killer, right? And I feel like sometimes because it's so prominent in our community, we often overlook it, but it leads to really serious complications, stroke being one of them. So blood pressure, check our weight or BMI. Are you gaining weight? Are you losing weight? And then also for immigrants, specifically the diabetes, because it's such a common condition in our community, cholesterol, and also mental health screening, just piggybacking on what Ms. Swartz said, checking our mental health and making sure that, our providers are asking the appropriate question as far as stress, anxiety, sleep, depression, things of that nature, cholesterol, and also for all adults, vision. and even dental. I don't want to leave that out. We definitely want to make sure we have all of our teeth until we are, old and gray. And so definitely making sure that dental screenings and routine cleanings are there. And then making sure that certain vaccinations, talking to your provider, like, hey, what vaccinations are important for me? Like flu and things of that nature, making sure that, our children are having the appropriate vaccinations. And I know there's a lot of controversy around vaccinations, so doing your research. But yeah, the overall adult wise, those are the main points that I want to hit on. And I also want to speak to, I don't know if in the chat, if there are a population that are 50 and older.
Yes.
But mammograms are very important for my patients that are 50 and older, and it's often overlooked. So just every 50 plus, you should be getting a mammogram like every 1 to 2 years. And then colon cancer screening. And then for my females, also bone density. This is not something that's too common, but bone density, you'll also see it as DEXA, DEXA. And that usually starts around 65. But the reason why it's so important is immigrant women, osteoporosis is very common, especially once you hit menopause and things of that nature. So a DEXA screening or a bone density screening is very important for my patients and loved ones that are 50 plus. And then just also honing in for my men out there, prostate cancer screening, also known as a PSA, you will hear from your providers, is important. That's also 50 plus. However, if you have a history of it, or if it's common in your family, or things of that nature, or if you're having symptoms, we started as early as 40. So, but if it's just a screening, you have no history of it, 50 plus, that's a very important screening for my men out there. Just knowing colon for sure, but definitely prostate, because that's also often overlooked in my immigrant patients as well. And then again, mental health screening, again, it's all again often overlooked, but it's super essential. So that's some screenings that I would definitely suggest.
Anything to add, Belle and Sword?
For our older patients, I'll add shingles and pneumonia vaccines. I can't stress enough, women, as you hit 50 and you begin to get into menopause, you start losing bone. So that DEXA and that bone screening is just a 5-minute scan that just goes over your body to see where you have bone loss. And there's definitely things that you can definitely can be done if there's bone loss, because we also, as we get older, the risk of falling and breaking limbs, then it's harder to heal. As I've heard so many people talk about their parents and they had a fall, and after that they never really recovered. They ended in a rehab and then they passed away. So that's we women especially, we start losing a lot of bone during the menopause time. So that's important. And I cannot scream loud enough on the mammogram for the women and the colonoscopy. Cancer screening, we don't have a lot of things for like pancreatic cancer, for lung cancer, unless, you can afford to do a whole body scan. But these are very specific things that have been proven to show that we can catch breast cancer early, we can catch colon cancer early, and these are huge things in our communities. Black women are starting to get breast cancer earlier and earlier, especially if you have a history and are getting more of the deadly negative, triple negative breast cancer. And if it's not caught early, can be really detrimental. So if those of you who do not like to, I have to get a colonoscopy every year, on like mostly it's 5 to 10 years because of my history. It's the best 15, 20 minutes of sleep that I can get because they put you under. The prep is not pretty, but it's just once every 5 years to prep it. Cologuard is an option that you can just send a stool sample that if you don't have history, you can quickly do. But those things can really catch stuff early. So please, 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 just especially once you hit 50, I mean, talk to your doctor. They're gonna let you know you need to do this, you need to do this, and please, prevention is better than cure.
All righty, we are just about to land the plane. Kendra, one thing, how can we build a better partnership with our primary care providers?
Yeah, so the first thing that I can think of is what Miss Sword had said before, just building a relationship, building that rapport. If I'm going to go check my blood pressure with my friend, it's not that daunting. It's not, the white coat syndrome is less likely to be there. So that's one thing that off the top of my head I can think of, just consistency and not making it such, don't avoid it. More so just making it more so routine so it's not too much of a shock to your system.
Okay.
And then making sure that you're choosing the right provider. As immigrants, making sure that you're choosing one that is culturally competent to you. And that again can come with establishing the appropriate community and making sure you're getting the right information. Making, if you there's a language barrier, it's 2026, well, almost, but they should have, most offices should have language services for bilingual patients, whether it's through an iPad or they have an in-service, in-person interpreter. So that's one way as well. And just also being honest. Again, there's a lot of fear as far as talking to providers or doctors, whether it's insurance or perhaps you're undocumented, things like, but you have to be honest in order to advocate for yourself in the best way possible. Sharing symptoms, don't leave anything out. Share the pain if it's stress, or don't try to mask or lessen the severity of your symptoms. Being honest with yourself and your provider in all aspects. If you're taking medications, let them know. If you messed up and took somebody else's medication, as Miss Belinda told us not to do, let us know so that we know, okay, you took somebody else's medication, that medication wasn't for you, so now how do we move forward? So really, really being honest, even if it's uncomfortable, honesty is the best policy in all aspects. So that's the best way that you can really build that rapport and get the right provider for you.
And if you're taking any herbal meds, let them know.
Yep.
But I like that. Don't leave anything out. Be honest. Okay. So we are just about to land the plane. Thank you everyone so much for joining us today. Actually, this is the last in the series for the year. This is our last taking charge. This is our last podcast, breaking through conversation for 2025. We will come back by God's grace next year with more conversations. But thank you, everyone. If you haven't subscribed, please subscribe. And as you know, these conversations are actually based on my book. We started based on my book, Breaking Through: The Immigrants Handbook for Thriving in the American Workplace. And our physical health, total well-being is all connected. So thank you for joining us. One final closing questions. I think I have two. If every immigrant, every person listening, any person who would watch the replay chose one wellness habit to commit to in 2026, what would you recommend? And why don't we combine it so that we land the plane? And what final encouragement would you give somebody who is starting to take charge of their health, but even feels overwhelmed or afraid? This is we are taxing. We know we are down. We are a few feet down to London. So
for me, Miss Marian, that annual physical could start a lot of things and placate a lot of things. Let's just start there, right? That one annual physical with your primary care provider. That could really, that's my first thing. Because again, we keep saying it, but prevention is better than cure. That one annual physical could really prevent a lot of things. And that it can also promote early detection. It can also promote guidance in certain things. It could also prevent fewer emergency visits. You don't have to go to the ER. So for me, again, that preventative annual physical, that's where I would start. And it hits all of checking your mental health, checking, your blood work, checking your physical being. It hits all of that so that we don't have to just, you're not only seen when things hit the fan.
Yeah. Wow. Preventative care, that annual physical,
That'll be my
annual checkup. I don't know
one.
about other countries how they call it, but over here in the US, there's one annual checkup where you do blood work, you see your doctor.
You talk
That
about
is the primary care person speaking to us. Just do that. Thank you, Kendra. Sword, say one thing about your business and then give the closing advice on that. Yeah, answer that
All
question.
right, I have a business. It is called is a behavioral health. It's Power Afrique, and it is located in Owens Mill. But I do telehealth, and I also, I see patients with behaviors. I see different patients with. I also do substance use disorders. I see patients like that. I see patients with PTSD. So any type of mental health disorder, I do see those patients, and I do home visit also for some patients. It's not all the time, but I do, because I have some mentally challenged patients that I really need my help, and I also go in and see them. So that is my business. One choice for wellness habit I can do in 2026, which have worked for me not only 2026, and I think I need to continue with it, and I've seen it firsthand, and it has worked for me, is choosing the right meal, eating right. Because I think one thing I did when I chose to eat correctly, it changed me physically, mentally, because I started seeing clear. I started making good choices, not only with my physical health, but my mental health and my personal health. So on that part, I think that's the advice I would give everybody. And it's not about you changing your own eating habit. I know Miss Belinda said something about sugar. I don't do no added sugar on any of my coffee or tea, but I know I love creamer. So I do the creamer. I don't add sugar. I don't add anything else. And a couple of days ago, I went to my work and I was telling somebody, oh, I'm drinking black coffee, and they were laughing at me. I said, well, I've drank creamer a lot. Now let me try black. So things like that, I do take that one step to start on something. And I saw that physically in me, that I have been, I feel better. Not only, I was 38 years old when I started this issue with my knee hurting, my back was hurting at 37, 38, and I get up in the morning, I'm saying, oh my God, I can't move. Why am I doing that? So that one thing I changed, and I knew I was eating bad. That one thing I changed to eat better. And then I do not skip breakfast. I used to skip breakfast, and I eat lunch and dinner and then supper. Oh, the middle of the night. I don't know how to call that meal. I eat I eat that. So that I changed, and then started sleeping early, because I do not want to eat at that time of the night. So I sleep by 9 o'clock. I'm sleeping, just because I'm not
You
thinking
eat
of
if you're
food
not
that time.
sleeping.
If I'm sleeping, I'm not eating.
That's
So
right.
then it started helping me with my sleep, which I was having issues with. So all of that, just changing that one aspect of my life, actually helped me in changing different part. And one final encouragement I can tell people, please, it is one step at a time. I start with that for your total health. You don't want to change and just drastically change everything right there. As they said, I think Kendra said it and Belinda said it about walking. Do not walk 30 minutes as a start. Start with 5 minutes, start with 10 minutes, start with just walking around, going through your stairs. I have an elder sister that I love so much. She come in and walk through my stairs. I have 3 flights of stairs. She go up and down, up and that's an exercise for her. Just doing that in your own house, it just helps. Start from somewhere, take one step at a time, start with something, and then just get your mindset correct. Your mindset is right, everything else goes in place. You're able to, when your mindset is there, you're able to get a physical exam Kendra said to get. When your mindset is okay, you're able to ask your doctor, advocate for yourself when you're asking them that this is the medication I'm taking, what is this for? So just take one step at a time. That will be my closing word.
I am feeling so smart and so blessed sitting here right now. Oh, thank you, thank you, thank you, thank you. Belinda, I will give you the last word and then we'll wind. Wait, before I give you the last word, why don't I read the comments here? Health is, oh, I can't see the comment anymore, but health is wealth. People are saying thank you all over. Thank you, thank you, thank you, thank you, thank you, thank you, thank you. Belinda, please land our plane.
I think just everyone, both my colleagues have said it, preventative care. And again, prevention is better than cure. And we say this mostly for our immigrant older population, because I think our younger folks kind of have fallen in tune with that already. So as we speak to our older immigrants, preventive care, and then slow down. Rome was not built in one day. One goal at a time. And then tweak your end goals if it's stressing you out or you're not reaching it. I like to have a minimal goal, a threshold, and a maximum. So I want to lose 5 pounds, by March, by March 2026. Okay. Then I want to, lose a pound a month or whatever, but I'm not reaching it. Okay. Then my minimum is, a half a pound. My threshold is maybe 1 and my maximum is 2. So if I have those goals set, and everything is not set in stone, so I can tweak it here and there. But just always remember self first, self-care. Before you are able to help someone, you have to put your mask on when that carbon pressure comes down, in order to be able to help someone else. So there's nothing selfish about it. I also like something that Ms. Ford has said: boundaries. Having boundaries. There's only so much that I can do. You can't stress yourself to the point where your mental health becomes an issue. So have boundaries. Have boundaries with your husband. Have boundaries with your children. Like, I'm not going to cook every single night. Okay. So, either we have leftovers or someone else jumps in, just so that maybe this night I can come home and just put my feet up, have boundaries.
Have boundaries. Oh my God. One step at a time, each right, annual physical. Ladies, what a powerhouse. This is a home run. You have landed us, ended 2025 on a very high note for our community. Thank you so much. Thank you for saying yes. Can you show them some love? Thank you to our panelists for sharing their wisdom, practical guidance, and I'm also hearing it's really not even perfection. It's that one step at a time. Wellness is not perfect. It's intention, it's consistency, one step at a time, one step at a time. And I hope you took you're taking with you a lot of nuggets, tips, strategies. Your well-being matters and you deserve care. Self-care, put your mask on. It's not selfish. You cannot pour from an empty vessel, from an empty cup. So as we move into 2026, choose one small step you will take this week, next week, make an appointment. Maybe it's the appointment you need to make. Take a walk, ask a question, or simply rest without feeling guilty. Rest,
Yes.
And if this conversation has helped you, please like, share, and subscribe to Breaking Through Immigrant Voices. Share this with somebody who needs a reminder that their well-being is worth prioritizing. I am Marian. Thank you so much for joining us. Until next year when we meet, take care.
Thank you so much.
Take charge. Keep breathing. Keep breathing.
Yes.
Keep breathing. Keep breathing in and out. But remember, every Wednesday we'll have something. We'll have a video, a recording on our YouTube channel. Thank you all so much, ladies. I am so proud of you.
You are so welcome.
Enjoy the rest of the day.
Nice to meet you guys.
Thank you.
Here. Bye-bye.
Thank you.
Bye.
Everyone, happy holidays and Happy New Year.
Yes.
Yes, we'll meet again.
All right.
Sure.
Bye-bye.
Bye.